Social distancing is more relaxed in Sweden. Much of Europe has gone into lockdown in the face of the coronavirus's relentless spread. But in the spring sunshine, Stockholm's cafes have customers. The schools are open, and the Prime Minister has urged people not to panic.
We hope that they are doing the right thing. I think that, we Swedes normally we are better at social distancing in the first place. So it just feels that we are continuing living the way that we normally do as well.
It's about saving the restaurants. It's about saving the pubs. It's about saving people's work. Maybe we have found a good balance, but let's see when it's over.
The elderly have been told to avoid social contact. Crowds of more than 50 banned, but otherwise people are largely free to go about their normal lives. This is how life might have been in Britain too, but then came that computer simulation by Imperial College London that showed that hospitals were about to be overwhelmed, 250,000 people could die, and the country locked down. But here in Sweden, the authorities just don't believe that research. The doctor in charge of the strategy has been charting the upward curve in deaths, but he insists the simulation was based on assumptions and poor data.
I mean, compared to us, it's hugely pessimistic, and I don't think any curve in any country has gone that bad as the Imperial College says it's going to be. And I don't think there is no real connection between having a lot of lockdowns, closing borders, closing schools and so on, and being safer.
Some scientists are horrified by the risk they believe the authorities are taking. Many lives could be lost.
I'm a scientist. I don't trust authorities. I trust data, and I don't see transparency of data that makes me calm to say that the strategy chosen is the best way forward.
But they might be right.
They might be right, and I will open a champagne bottle then. Because this is not about me and who's right or wrong. I think that we should have an open discussion about the scientific data.
The authorities are building a field hospital just in case.
So this is one of the wards then?
That's correct. This is one of possible 60 wards. In every ward it will be 10 beds.
The first patients are expected as soon as Monday.
You work with Médecins Sans Frontières, Doctors Without Borders. Yeah. Did you ever imagine you'd be building a hospital like this in your home country?
Never, but I'm sure nobody anticipated what we're seeing now in all levels of society.
Sweden is hoping to let the virus spread slowly, an aim Britain once shared. Now the UK is trying to completely shut it down. There's no way of knowing which strategy will save more lives in the long run. Thomas Moore, Sky News, Stockholm.